The broadcast is now starting. All attendees are in listen-only mode.
Hey, good afternoon, everyone. This is Ken from All Chicago. Thanks for joining. Just so you guys are aware, just a couple of kind of housekeeping things. Everyone's going to be muted. If you have any questions, just go ahead and use the question box as we go through the slides here. And then the other thing is that this will be recorded and posted to the YouTube channel, so you'll be able to check it out later as questions come up. So we'll go ahead and get started. I've split the presentation into three different sections, basically. The first one, we're just going to kind of walk through a couple of pieces of the Skilled Assessor Agreement. That is the agreement that all of you signed and submitted before you got access to the system and before you were able to do any assessments. So there are some questions that people have, and some of the things that we're going to cover today are directly related to what's in the agreement. And so I thought that that would be a good place to start. The second section is focused on common challenges that we see frequently. And so I just wanted to give a quick refresher on some of the most important pieces of the assessment and the challenges that we see associated with those. And then the third piece I'm just calling data collection improvements. And these are things that are not necessarily issues or errors when they're missing, but we do think that we would like to see them done more consistently and more accurately. And so I want to focus on that as well. So we'll first get started with the Skilled Assessor Agreement. Hopefully this looks familiar to you guys as you've at least looked at it when you signed the page that's behind this one. And so what this really comes down to is that we give skilled assessors an incredible amount of access to the system. You guys have access to some information that no one else has access to. And we had a lot of people sign up and volunteer to be skilled assessors, so we thought that there must be some way for us to allow people to be skilled assessors, but also limit the access to these parts of the system to people who are actually using this project for what it's there for, which is to assess people. And so that is where this confidentiality piece comes in. During the trainings, I go over how you guys see the disability information that people give you, and that is not shared with the housing provider. So, and that includes the VI information too. So that right there is information that no one else will have access to in the system but you guys. And so in order to keep your access, the next four things on this list are the expectations that we have for you. And so I'm going to talk about three of these things. I'm going to talk about why we have them as expectations, and then how we measure them, because there has been some confusion about that. So the first one is frequency, and this is the one that we see most people when they are exited from the skilled assessors, when their access to the project is removed, it is because they don't meet this expectation. And so the reason that we have this expectation is twofold. One is due to that confidentiality piece, right? We know that because you have access to that sensitive information, we want to make sure that you're using the project for what it's there for, and so we put that limit on there. The other reason is for data quality. We find that those who do assessments more frequently or more often will be more comfortable with the process and complete the full assessment. This is not a normal workflow that our HMIS users use. The Skilled Assessors Project workflow is definitely different and has some weird kinks in it. And so the more that you do it, the more we think you'll feel comfortable doing it, and the less we'll have incomplete assessments. The way that we measure this is complete assessments. So the person has to have an entry into the Skilled Assessors Project, and the VI must be completed. when I talk to people about, hey, you haven't done 2 assessments, so we may remove your access. They give me HMIS IDs of people who they think that they've assessed. The problem is that they don't have an entry or the VI is not completed. So they're not complete assessments. They are not measured or they are not counted as an assessment that you've completed because they're incomplete. And I will talk more about entries, actually doing the entry workflow and the VI a little bit later. The second one that we'll talk about is quality. These are closely related, obviously, because when we're talking about quality, we're talking about complete assessments. And we think that quality data leads to better matches and more people in housing. We've seen this over and over again when housing providers request rematches. A lot of times it's due to poor data. So some of that's chronic homeless data, contact information, housing status even. So this quality data really leads to more people in housing, and that's what this is all about. How we measure this is complete assessments again. So there's an entry into the project. The VI is completed. If you have to use EDA mode, you're using the correct EDA provider. And then lastly, there's no missing data. The missing data piece is really seen on a case-by-case basis when we look at assessments for these other reasons. We're not combing assessments to look for missing data, but we are alerted very quickly about missing VIs and incorrect providers with enter data as mode. The third one that we want to talk about is observed disabilities. And so the reason that we've put this in here, the reason that we think that this is an important thing to measure is because this is a tool that we've built in so that people who don't have insight into their conditions are not penalized for this lack of insight. So this is a way for people who have severe mental health conditions, stuff like that, will not be penalized on the assessment for saying they do not have a disability when in fact they do. Since chronic homelessness requires a disability, and we've prioritized people who are experiencing chronic homelessness for many of our housing interventions, if someone did not have insight into that condition, they may not be prioritized for those interventions, which is probably what they need. And so this is the tool that we've built into this process so that those people can be matched to appropriate housing. How we measure this is that once a person is matched, if the person has an observed disability, are they eligible for that program that requires a disability? So if the skill assessor observed a disability, this person was matched to a project that requires chronicity or requires a disability, the housing provider is then verifying your claim by going through their process to getting documentation. Does this person actually have a disability? So that's how we're measuring that. So the next piece of this presentation will really just talk about these common challenges. A lot of this is going to relate directly to the stuff I talked about in the skilled assessor agreement. So EDA mode, VIs, creating entries, that type of stuff. So where this can get a little confusing with enter data as mode is that we actually have 2 different workflows for skilled assessors. Some of you guys are created as only skilled assessors. So the way that we're viewing this is that the only reason that you're using ServicePoint, that you're using HMIS, is to complete coordinated entry assessments. You're not entering any information into your own projects. So the easy way to tell if this applies to you is if you log into ServicePoint and you look at the top left of your screen, right under All Chicago, you will see your agency. If you see this agency, the Chicago Coordinated Entry System Skilled Assessors Project, you do not have to use enter data as mode at all. You would just start completing your assessment. You would go to the client's profile, add an entry. If you look at the top left of your screen when you log into ServicePoint and you see anything else, if you see Matthew House, Heartland Health Outreach, Heartland Human Care Service, anything besides the Skilled Assessors Project, you must use enter data as mode. how you use enter data as mode. If you look to the top right of your screen, when you're logged into Service Point, you will see the option that is called enter data as. Once you click on this box will pop up, this enter data as provider search, and you will want to click the green circle next to the Skilled Assessors project. As I've said in the training, what this does is it makes it so that the data you create using this provider will now be able to be seen by this provider. If you do not use enter data as mode and you just enter data, if you create an assessment, the assessment will not be viewable by the matching team or the housing provider once that person's matched. You will get emails from All Chicago asking you to re-enter the data using the correct provider in enter data as mode. So again, look to the top left of your screen. If you see the Skilled Assessors project, you skip this part. If you do not see the Skilled Assessors project, that means you must use enter data as mode, and that option is on the top right of your screen. The second challenge that I want to go into detail about is creating an entry. Recently, we've gotten some questions from people who, when they've been removed from the Skilled Assessors project, or when we've removed their access to the project, or we've given data to people saying, hey, you haven't completed this many assessments, there's been some confusion, and people say, well, I've completed so many assessments, here's the IDs. The issue is that there's no entry into the project. People are actually finding a different way to do this, and I'll show you that on the next slide. So just to reiterate, there are only two places you should ever complete an assessment, and that is in an entry and in an interim review, and we will cover both of these today. Regardless if it's an entry and an interim review, they must be completed in the Skilled Assessors project. Okay, an assessment created elsewhere will not count as a complete assessment, and more importantly, it may prohibit the person from being matched to housing at all. And so to create an entry, you can see here that we're looking at a client's record. We've gone to client search or client point, and we've created the record, or we found the record, and we want to create an entry. We want to complete an assessment with this person. So we need to create an entry. So it's right here on the right of your screen. You just click Add Entry Exit, and that's how you begin that process. What you do not want to do is go to the Assessments tab, which is on the far right of the client's record. I know we talk about assessments a lot. We say we're going to complete a coordinated entry assessment or a standardized housing assessment. It would seem like it would make sense if you would do this through the Assessments tab. However, that is not the case. We would never use the Assessments tab. We will never use the Assessments tab. Ever. So we're only completing assessments in the entry or the update, never in the Assessments tab. Another piece of creating an entry, and this is something that we see pretty frequently as well, when you are creating an entry for a household that has more than one person, when you click Add Entry, this box will pop up, and we will obviously choose HUD as the provider type or the project type. We always choose HUD, but what we are seeing a lot of people do is adding in all of the rest of the household members to the assessment. And we would prefer that you don't do that, actually. If you only just add the head of household, everything's a lot smoother. So what this looks like is if you added in this person's child, and you completed the assessment with the head of household, it then looks like this child is missing a VI. It looks like the child is missing all this information, even though that child shouldn't have a VI and shouldn't have this information. So in order to fix that issue, we would just prefer that you're not entering in anyone but the head of household into the Skilled Assessors project. So in order to do that, you would just make sure that this box is unchecked. You only want to have the head of household box checked. Okay. And so the next thing I want to talk about is adding a VI. This is something that we stress really hard in the training in general, because this is one, it is a common mistake or common challenge, and the other thing is that it's kind of an awkward workflow. It's easy to miss, so it makes sense that it's missed so frequently, because it's so awkward to have to do. So after you complete this first assessment, the standardized housing assessment, and you complete, however many questions are in here, 40 questions, we're all the way at the bottom of this. We actually have to scroll all the way back up and click on this assessment. And we know how important it is to have a VI. Without a VI or a vulnerability index, the person cannot be matched to housing because they can't be prioritized. We don't know, without a VI, we don't know what housing intervention is appropriate for the household. So they can't be matched. Once you click on that second assessment, you will see the disability questions, and then you'll see this piece here. And this is where you'll be adding the VI. There's an individual VI, youth VI, family VI. You would determine which VI is appropriate, which I will do on the next slide, and then you'll just click add. Once you click add, the vulnerability index assessment will pop up. Each one has different questions, as many of you are aware, and then you'll complete those questions. Some of the questions are scored, and that person will then have a VI score and be able to be prioritized on the one list and then be matched to housing by Catholic Charities. So which VI do you choose? Another common challenge that we see is that people are choosing the wrong VI sometimes. And I think the most common mistake here is when people are choosing between a youth VI or a family VI, because that's the one that is the least intuitive. And so what we're advising is that if the head of household is under the age of 25, so if they're 18 or 24, you're going to do the youth VI, regardless if they have children or not. It could be a 24-year-old with multiple children. You would do a youth VI. Okay. Once that person turns 25, if the head of household is 25 and over and they have children under the age of 18, that's when you'll do a family VI. Individual VIs can be a little weird as well, because when you think of individuals, you're thinking of one, but many different types of households can fall under this individual VI. So the individual VI is done for a head of household age 25 and over if they do not have children under the age of 18. So this does include couples, as long as the head of household's over the age of 25. This does include households with multiple adults. So if someone is living with their friend or their brother or sister or something like that, you would want to assess the head of household with the individual VI. And this also includes households with adult children. So if the head of household is older and they have an adult child with them, someone over the age of 18 who's living with them, that is their child, you would still do the individual VI. You would not do the family VI. And in case, when you're completing an assessment, you get confused and you're not sure which one to pick, all of that information is actually typed up here as well. So right in the assessment itself, you have the guidance right above there to tell you which VI to choose. As we move along, another data collection improvement, or I guess this is the part where we're talking about data collection improvements. So this is not really about errors per se. This is really about improving the system in general with our data. And so what we're seeing is so this data is of March 5th. And so as of March 5th, there have been 7,001 assessments completed, but only 475 of those have been updated. Okay, so one of the things that we stress in the The training is that we really want people to update assessments when they come in contact with a household that's already been assessed. We want you to take a look, excuse me, and make sure that their assessment or that their information is updated. And so what that would be is looking at contact information, looking at income, all these things that may change. We want to make sure that we have the most up-to-date information. A simple thing that you may want to update is if you are working with this person now, you may want to update the skilled assessor information so that your contact information is included in there instead of the previous assessor. They could have gone to an access point and been assessed with someone or by someone who they've never spoken to again, but they're in your shelter now, and you want to make sure that you're contacted if they're matched to housing. So updating your information could be a reason for an update. Sorry, I'm getting a couple questions. I just want to make sure that I'm reading these as we're going along. Okay. And so another reason why we're really interested in these updates being completed is that 17% of matches since April 19th, 2017, so that is the day that youth matching began, 17% of matches since then have been, their need status indicate that the housing provider was unable to contact the client. So an easy way to solve for that, we hope, or an effective way to solve for that is if you're updating contact information when you have the ability to. The workflow, so I've made a video that shows how to update. This is about a 3-minute video. If you can just click here. After the presentation, I'll send out that information to you guys as well. So it's a 3-minute video that will walk through the, the workflow for updating the standardized housing assessment. And here's just a pictorial view of how to do that. Once you go to the client's record, you want to click on the entry and exit tab, which is located in the middle of the tabs here. On the entry and exit tab, you want to find the entry associated with the skilled assessors project. So this person could have many entries here. Could have shelter stays, could have old permanent housing entries that you may see. So we want to make sure that we're adding this update to the correct entry, which is the Skill Assessors Project. So you find that, and you look over towards the interim column, and you click on the document within that interims column. When you click on that, this box will come up, and it will ask you which type, or will ask you if you want to edit any of these interim reviews, or if you want to create a new one. We want to create a new one by clicking Add Interim Review. And then we're just selecting Update from this drop-down menu for which type of interim review we're choosing, and then you click Save and Continue. After you do that, the assessment will populate in front of you, and you'll be able to erase everything right there. Erase and edit and add new information. So I'm getting questions regarding should we assess adult children if they're part of another household? So for example, if there is a 40-year-old head of household living in a shelter, so this is probably just for family shelters. If there's a 40-year-old household living in a shelter with a child who's over the age of 18, are we required to assess that adult child? The answer would be no, actually. So there's going to be some nuance in your conversation with the households. In this example, you wouldn't want to assess that 18-year-old child unless that 18-year-old child was planning on living alone. So if she's still going to be a part of that household, you'd want to assess the household as a whole. And in that case, you're assessing the head of household and you're using the individual VI. If the 18-year-old child wanted to live alone, you would assess that child alone and you would do the youth VI. So it all depends on the decision of the household. Then there's a question more related to reporting. Is there a way to view all the clients that you've ever completed an assessment for? This is a good question that we get pretty frequently as well. If you are interested in that information, you would want to email the help desk, and that is HMIS@allchicago.org, and we would be able to provide that information to you. Unfortunately, you're not able to get that information yourself right now. So you can email us and we'll be able to provide you with the IDs for all the people who you've assessed. Moving on a bit, I'm going to spend a little bit of time talking about chronic homelessness, but I do suggest that we do generally 2-hour trainings when we talk about chronic homelessness, so I will suggest that you sign up for a training, and I have the link to the learning management software. It's kind of a new thing that we have here at All Chicago, and you can register for trainings there. So I'll have that link in a couple slides for you to go into a more in-depth training, but I'll just kind of go over chronic homelessness and how we advise you to collect that data. So first, the definition of chronic homelessness. In order for someone to meet the definition of chronic homelessness, the head of household has to have meet all of these criteria. What that means, some people have questions of, let's say that a child has a disability, but the head of household doesn't have a disability but meets the length of time homeless requirement. Unfortunately, that household would not meet the chronic homelessness requirement because the head of household has to have all of the requirements. So in order to meet the definition of chronic homelessness, the head of household first must be residing in an emergency shelter, a place not meant for human habitation, or in a safe haven. And of course, this does not mean the safe haven organization on Roosevelt in California. This is a HUD safe haven model. The person also has to have a disability, and they have to have been continuously homeless for the last 12 months consecutively, or a minimum of 4 occasions of homelessness over the past 3 years, totaling a minimum of 12 months. Sorry, it cut off there. So there is a 12-month requirement, either consecutively or over 4 occasions in the last 3 years. Occasions are broken up by breaks, and a break is having been in a place meant for human habitation. So this is their friend's house, family member's house, a hotel room, any type of place where humans should live. So these are not homeless situations, for a period of at least 7 nights. So this is how we come up with occasions. Or a break is having been in an institutional setting for a period of more than 90 days. And so I give you just a brief definition. I know that that's confusing and that we're not going super in depth into the nuances of that right here. But what we do want to do is show you how to collect that information and then also how to enter that information in Service Point, because it is a bit confusing. These are the questions where we understand if someone is experiencing chronic homelessness, but we ask that you please do not ask these questions directly to the client. We find that a lot of times clients' answers to these questions are not actually the accurate information that we get if we did create a housing history for the last 3 years for the client instead. What we'd really prefer that you do is create this housing history for the last 3 years. So that's just a conversation with the client, going through their housing history of the last 3 years, and then using the information that you obtained to answer these questions yourself. In order to get that housing history, we've developed this little tool here called the Housing History Tool. And we'd suggest that you use this or something like this in order to get that information. And in order to use this, you would basically start with last night, and you just ask the client, where did you sleep last night? And continue doing that until you reach 3 years from today, or 3 years from last night. So once you have that 3-year housing history, you're then able to answer those HMIS questions that I just showed, and I will talk to you about those in the next slide too. This is the link to get to the housing history tool. It is on our help desk, so you can just go there and download the PDF, and then you'll be able to print it out to use in your conversations with clients. So I do want to translate basically these questions for you. They are written in a strange way, and it doesn't really ask the questions that they're trying to, for the information that they're trying to gather. So I just want to kind of go through that. So current residence living situation is really asking you, where did the client sleep last night? This is not asking where they are today. This is, where did they sleep last night? Length of stay in previous place is really asking, how long did they stay in the place they slept last night? Okay? And now these two are where we get a little confused. Approximate date homelessness started is not asking how long have they been homeless. It's not asking when did they first become homeless. And it's not asking how long did they stay in the place last night. We're really asking, when did this occasion, or when did this episode of homelessness begin? A client will not be able to answer this question in general. You will have to use the housing history tool to look through and make sure that you're going back to their last break, and then that is when this episode began. These next two questions are more self-explanatory. The first one is just asking how many episodes of homelessness has the client experienced in the past 3 years, and then the total number of months the client has experienced homeless in the last 3 years. I'm going to answer a couple other questions. One question: between couples, an assessment should be completed for both adults or just the adult considered as the head of household. So in this case, it really depends. So you can complete an assessment on both adults, and within the assessment itself, you would indicate the household size as 2, and you would indicate that there are 2 adults in the household. And you would just do the individual VI for both people, right? So you would have you would enter the first person in the couple, do the assessment, do the VI, and that's completed. Then you would create an entry for the second person in the couple and do the VI, and then that's completed. And then really what we're doing there is giving them kind of 2 chances to be matched, right? So in the assessment itself, we're not asking who is this person's partner at all. So we just know that there are 2 adults in the household. So that you could do that way, definitely. And looks like that was the last question. Okay. So that's chronic homelessness. Like I said, I know that talking about chronic homelessness for a few minutes is not nearly enough to get a really good grasp of the definition or how to gather that information. So if there are some chronic homelessness training scheduled, I believe. Now, the one caveat that I would say is that many of all of the chronic homelessness training scheduled right now are geared toward permanent supportive housing providers, and it's really more focused on their documentation requirements for permanent supportive housing providers. We have done a few chronic homelessness trainings geared towards skilled assessors in particular, and so that focuses more on what you guys would be doing, which is gathering that information, using the housing history tool, and getting that person ready to be matched to a permanent supportive housing or permanent housing provider. None of those are scheduled right now, so it is totally up to you if you want to go to the permanent housing one. You'll still walk out of there, I think, with a better understanding of what chronic homelessness is, and how to gather that information. It's just not going to be geared perfectly towards the skill assessor role. Um, and then moving along, the the next data collection improvement that we would like to see is just uploading documentation. And so this graph here shows that, and this was as of last Tuesday, I believe, the average number of days from match to housing is 85. That is 85 days before someone's housed after they're matched, after that referral has gone through. And so we have seen this decrease about 30 days within the last 6 months. So, I mean, that's great for sure, but we do think that it can go down even more. And we think that you guys play a role in that. One of the things that we think that you can do to reduce this is to upload documentation whenever possible. And so when someone's matched to housing, the housing provider gets into the mode where they have to collect all the documentation to determine whether this person's eligible or not. That time can be severely reduced if the documentation is in Service Point all ready for them to go. And you guys can play that role. So in order to do that, just a quick refresher is to go to the Client Profile tab, which is the second tab from the left, from the client on the summary page of the client's record. You'll scroll down a bit to File Attachments. It just has its own section called File Attachments. And then you will add a new file attachment, and you'll browse your computer for the file, and then click Upload. So this does mean that you will have to upload or scan the documentation into your computer somehow. You will want to make sure, again, if you have to use Enter Data As mode, you want to make sure that you're using Enter Data As mode when you upload this documentation. So those are the last question, or the last topic that I'm going to cover. However, I do have a couple questions that were sent in prior to the training that I want to go over as well. One of the questions was asking about whether records get locked automatically if people indicate that they are fleeing domestic violence. The answer is no. So records will never be locked automatically. You have to lock the record yourself if the person says that they are fleeing violence or human trafficking. If you are unable to lock the record, then you would contact the help desk, and that's HMIS@allchicago.org, and then we would be able to lock the record for you. The next question is, if we see that a standardized housing assessment has been completed recently and the information is incorrect, what should the next steps be? Oops, sorry about that. What should the next steps be if the information in the assessment is incorrect? You definitely want to do an interim review. So you'd want to update that assessment, and then you can click on this YouTube link, and that will show you how to update an assessment. This is the way that you correct information. So I would definitely, if you get into contact with someone who's been assessed, please check the record to make sure that the information is correct with what you know about the client. Sitting down with them and going over their assessment and just making sure that everything is correct is definitely advisable. And you would use this procedure here. And then a related question is, if we are to correct mistakes or update information, in which cases would you do an interim review versus changing or adding information directly to the original assessment? I took a while to think about this one, to think about how to explain, or if I should explain, when you might want to add information to the original assessment versus doing an update. And I don't I think it's just an easier explanation for everyone just to say always do an update assessment. Never change the information in the actual assessment. The downsides of doing it within the entry are a little bit too high to kind of split hairs for when that might be advisable. So I would say whenever you see incorrect information, whenever you see missing information, use the update assessment to correct that stuff instead of the original assessment. Before I end, I'm going to check to make sure there are more questions. Okay, this is a good question. After locking a record for a client fleeing domestic violence, I've been emailed by a housing provider saying that they received a referral from my client but cannot view the profile. How do we lock correctly so the necessary info is still viewable by housing providers? That's a really great question. You guys cannot do that. So in this case, the housing provider should really be contacting the HMIS team in All Chicago, and we will then provide them with access to the record. If you guys ever get emails like that from a housing provider saying that they cannot see an assessment or cannot see the record at all, please contact us and we can fix that issue very quickly and very easily. If you still have the record, if this was a recent thing, email me and I can look into that issue for sure. Okay, looks like that might be the last question. Okay, so I'm going to end the webinar. Like I said, this will be recorded, so I'll upload it to YouTube in a bit. If you have any other questions, go ahead and email me. And thanks for joining.